If you experience numbness, pins and needle sensation, and tingling in your lower leg and in your foot, and wondered if this is something that you need to worry about, well, I have you covered, because in this video, I will teach you the 5 symptoms that you should never neglect with foot and lower leg nerve pain. Stay with me until the end, because the last symptom, it is very important not to ignore because it is considered a medical emergency. Hi, this is again Doc Sherry, Doctor of Physical Therapy, teaching you practical health tips and home exercise programs that you can surely benefit from. Lower leg and foot numbness are relatively common, and in some instances, it is very easy to take these symptoms for granted. However, these are the 5 symptoms that you should never neglect. You need to have yourself personally evaluated. Muscle weakness. If you experience numbness, pins and needle sensation, or even sharp shooting, burning type of pain in your lower leg and in your foot, plus you recently experienced muscle weakness in your lower leg and foot, where you seem to feel that there is no strength, please have yourself evaluated, because these can mean 2 things. During the early stages of nerve damage, muscle weakness are usually not experienced. Second, you need to have yourself evaluated to really find out the cause of the muscle weakness so as to give you prompt medical attention and prevent worsening of symptoms, because if left untreated, it can very well affect how you stand and even how you walk, even in the coming years. Spreading symptoms. If initially you felt nerve symptoms in your lower leg, but recently also experience it on your foot, please have yourself evaluated, because usually this means worsening nerve damage. In the clinic, we have a concept for this which refers to peripheralization of symptoms, which connotes worsening of the condition. If you will seek prompt medical treatment, you will find out and you will be checked what is the reason behind. And second, maybe also your current management is not enough, so we need to modify your treatment plan. Changes in your skin color and temperature. If you feel nerve symptoms, plus you experience that your lower leg or your foot becomes pale, it is now bluish in color, and it is cold to touch, these are not usual nerve symptoms. Please have yourself checked, because these can be symptoms of what we call as peripheral arterial disease. Peripheral arterial disease happens if there is poor blood circulation in your lower leg and in your foot due to a block in your artery. This needs to be personally evaluated, because if left untreated, these can lead to other problems like stroke. Now, before we continue to the last 2 symptoms that you should never neglect with lower leg and foot numbness, please comment down below, yes or no, if you have experienced any of the 3 symptoms that I have already mentioned. Also, if you find this video helpful, I would really appreciate it if you can click the like button below. This will really help the channel grow. Recent injury. If you have a history of trauma and now you experience numbness and pins and needle sensation, please have yourself personally evaluated, because this can be due to a compressed or damaged nerves. You need prompt medical treatment. Lastly, a very important symptom that you should never neglect is loss of balance and coordination. If you have experienced nerve symptoms, plus now you experience difficulty with balance, you find yourself always falling. This shouldn't be taken lightly. please have yourself evaluated. We need to check if your spinal cord is affected. You see, your brain and spinal cord, it makes up your central nervous system, and it is responsible for our movement. This needs to be properly addressed to make sure that there is no worsening of symptoms that can very well affect your mobility. So to recap, here are the 5 symptoms that you should never neglect with foot and lower leg numbness: muscle weakness, spreading symptoms, changes in the color and in the temperature of your skin, recent injury, and loss of balance and coordination. If you have reached the end of this video, please comment guided in the comment section below. I would really love to hear from you. If you want to know if the cause of your lower leg and foot numbness is due to sciatica or a pinched nerve in the level of your spine, we have a video here. Check on this. It will greatly help you. Thank you very much for watching. I wish you well. I will see you on our next video. God bless you.